Many are calling it a shot at hope. The first COVID vaccine not only may help us reduce the spread of the virus, it may also help us improve the way we feel about the future. As medical reporter Liz Bonus explains, this pandemic has taken a real toll on our mental health.
1 in 5. That's the latest from a new study, which shows 1 in 5 of those diagnosed with the virus also has a mental health concern, such as anxiety or depression, to follow. But even if you don't get this virus, surviving COVID-19 lockdowns and isolation can set all of us up for some of these same concerns, leading to some unhealthy coping mechanisms too.
You know, it wasn't the alcohol itself, it was this hole in my heart that I didn't know why I was doing it.
Sarah Brown knows what it is to struggle with those coping mechanisms. She struggled with alcohol as a young mom for years.
When I turned 29, that's really when I hit rock bottom.
She's not the only one. A study in JAMA Network Open found heavy drinking among women defined as 4 or more drinks within a couple of hours has spiked 41% compared to last year at this time.
We have seen more females coming for treatment than we have males.
DeCoach Rehabilitation Outreach Coordinator Chastity Mason says both men and women are feeling the stress of this pandemic, but especially women.
Women are doing the home roll right now, which has been a lot stressful than normal. So I think that just the change in the way the pandemic is rolling out, it's really affecting women more so than the men.
Those who've had the virus are also feeling the after effects. Here's Dr. Shauna Feibel of the Linder Center of Hope.
We find that this is probably due to a number of reasons. First of all, the quarantine is so long that if you are exposed and you are positive, you will have to be alone, probably not much contact with friends and family.
As for how to cope, Dr. Feibel says there are 3 things that make a difference. First, take care of the body, which generally means get moving.
There was a study just not long ago that said that people who exercise are less likely to get the coronavirus, COVID-19, and if they do get it, they're less likely to experience severe symptoms such as the ones that would send you to a hospital.
Second, get engaged. Bev Stewart is a retired nurse who is helping to make masks and much more at this needle and thread sewing group at Calvary Baptist Church in Latonia.
Once a nurse, always a nurse, and it always stays with you, so if you can help someone else, then it's still purposeful.
Finally, don't be afraid to ask for help. If you're feeling sadness, anxious, or even hopelessness right now.
Everyone struggles with something, and it's okay to not be okay sometimes.
You may also be able to get a proper antidepressant prescription for your needs based on testing from your own DNA. Your primary care doctor is likely the best person to talk to if you're feeling some of these symptoms. That person can refer you then to the best counselor or a guide to get you through this COVID-19 crisis time. I'm medical reporter Liz Bonus. We'll throw it back to you.
And if you know someone who is struggling, we have links and resources for you at what'shappeninginhealth.com. Just click on this story.